We have a very active vein department here at NYCVA. We treat a wide spectrum of patients with vein disease, anywhere from patients who have mild symptoms from spider veins and reticular veins, to patients with large varicose veins, to patients who have more severe manifestations of venous insufficiency and varicose veins like stasis changes and swelling or edema or even leg ulcers. The treatment options in 2012 for patients with severe vein disease are all non-surgical and involve appropriate diagnosis with ultrasound and then treatment with endovascular techniques. Endovascular techniques are really treatment options that are performed through a needle or just a needle stick with a catheter. We perform these procedures here on the premises at NYCVA. We also have trained attending anesthesiologists available. There are a number of types of treatments that we offer patients with vein disease, and we break them down into three main categories. The first are the so-called thermal catheterization techniques. Thermal techniques involve a catheter that emits heat energy. There are two types that are used. The first technique is called EVLT, or endovascular laser treatment. With endovascular laser, a small needle is inserted into the vein that has to be treated, and then a very, very thin laser fiber is passed through the needle. When the laser is turned down, the vein closes shut. We slowly withdraw the laser fiber and withdraw the needle and then wrap the patient's leg with an ace bandage. Second technique that's available is called the radiofrequency or venous technique. It's very similar to laser, except the heat source instead of laser is radiofrequency energy. Radiofrequency energy has a number of beneficial effects. There's not as much energy emitted as with laser. So in some series, the side effects, the complication rate is less with radiofrequency energy. We employ both techniques routinely here at NYCVA. We spend a lot of time and effort looking at each individual patient and each individual vein in that patient to determine what the best treatment option is for that patient. We don't have a preconceived bias of using one treatment over the other in patients, and that makes us unique from many of the other vein centers here in New York City. The second treatment option is ultrasound-guided sclerotherapy. Ultrasound-guided sclerotherapy is a very similar technique. Again, it's introduced just with a needle into the dysfunctional vein, but then a sclerosing foam is injected into the vein. This is a very simple and very quick procedure and is painless to undergo and takes only 10 to 15 minutes to perform. The last treatment that we offer patients is something called microflebectomy. With microflebectomy, we physically remove varicose veins from the patient's body. This is achieved with, again, a small needle stick and a very small surgical hook, which teases the vein gently out from underneath the patient's skin. Again, all these procedures are done fully ambulatory. There is anesthesia available for patients who request it, and most of them take less than 30 minutes to perform. Since these procedures are all ambulatory, patients can usually return to work the following business day.